All right, Dr. Cohen. So first, I want to ask you about these 4 benchmarks that we keep hearing about: COVID-like illnesses, lab-confirmed cases, positive tests, and hospitalizations. Are you still using those as benchmarks? And if so, what do they look like today?
Sure. Well, first, thanks for having me on. And yes, we are definitely using our data to drive our decision making. And so you can go to our dashboard right now and follow along with us on our 4 key metrics. We look at things like our surveillance data, which tries to give us the most early detection we can on COVID-19 cases. We obviously look at day-over-day cases. We look at percent positive of the total tests we're doing. And then we look at hospitalization as well. We're going to go through these in more detail. I'm going to be with the governor later this evening going through them in detail, but you can look on our website right now. And what you can see is the trends are largely stable, which is a good thing. And that's because North Carolina took early and aggressive action to slow the spread of the virus, and it's worked. We have truly flattened the curve, and now it's time to think about how do we ease restrictions and continue to slow the spread of the virus. So that's what we'll be talking to the state about later this afternoon.
Yeah, since you bring it up, is there anything else you can tell us about what the governor and the task force will be talking about today?
Yes, so this evening we'll go through these trends in detail, and I'll bring up my graphs. And for everyone who likes graphs, there'll be graphs, and for those of you who don't, I apologize. But so we'll go through those numbers so folks can understand how we are basing our decisions, and we still want to take a measured approach as we go forward. So as we think about easing restrictions, it is going to be a phased activity, and so the governor will go through the items in terms of the first phase. We've already laid that out at a high level. I don't want to get in front of the governor and him sharing all of those details, but essentially it's going to open up a number of the businesses and to allow folks to leave their home for more purposes. So I think that this will help us start to get back to what is going to be our new way of interacting in the world. We know this virus is going to be with us, and so it's a matter of how do we protect our families and our neighbors as we ease these restrictions. And so we're going to have to learn some new ways of being with each other. It's going to take us wearing face coverings when we're near other people. It's going to take us washing our hands and then waiting 6 feet apart. So you're going to hear me talk about the 3 W's: waiting, washing, and wearing, as we move forward into these new easing of restrictions.
And I just want you to know that everyone in our newsroom really does appreciate the graphs. So I know you brought that up several times in the press conferences. We really do love the graphs, so keep those coming.
Good.
We look forward to seeing those again
No
today.
problem.
Dr. Cohen, you talk about the
Good.
phases. You and the governor have laid out the 3 different phases of reopening our state. I'm curious to know if you've said once we start reopening, we start getting into these phases. If we start to see those benchmarks go in a level that we don't like, we might have to impose more restrictions again or step back a phase. Is there a number you're looking at in order to go backward in a sense? Is it if any cases come about at all? Is there a certain number that you're using as a threshold?
No, great question. And so I will say there is not an absolute number. So as we move into this first phase, we want to do it in a measured way. So we want everyone to continue to try to do all of these new things, the 3 W's, stop the spread of the virus, but start to return to shopping and leaving their home for different purposes. And so as we do that, we will continue to look at these same trends. There isn't an absolute number, but we're going to watch it over a period of time. And if we see a spike or a surge, particularly if we see that in one area of the state, we will have to impose maybe stricter restrictions again. I hope we don't have to. I think North Carolina has set ourselves up in the best position possible to be successful. And I think if we can all pull together as a state and work together, that we can move through these phases successfully. Yes, we'll have to look at the trends, and if we go the wrong direction, we don't want to put people in harm's way. We want to save lives. We don't want to overwhelm our medical system, and we will have to pull back. But there's not an absolute number. We'll have to look at trends, and that will guide our decision making.
And as we start to look toward the future and toward reopening, what does it look like to you, Dr. Cohen? Are we going to sporting events? Are we traveling? Are we wearing face masks? What does that look like?
Well, I think the first phase is not going to involve sporting events at first. First, we're going to do activities that we know are lower risk of transmitting the virus as we all start to get used to this new way of moving through the world. So we'll start with lower risk activities that involve more walking through spaces. We want to make sure the parks are open, so walk through parks. We still want to keep mass gatherings down, and you will see us keep the mass gathering at 10. But we hope as we move through phases, we can open that up more. So we hope this first reopening phase, easing restrictions phase, is going to be a short period of time, 2 weeks, maybe 3, and assuming all the trends move in the right direction, we can go further. So I think that we're on the right track for North Carolina, and what I would say is I'm so grateful for everyone who has been working so hard to abide by the guidance that we've been giving. If we can continue to abide by this guidance, we're going to be able to move through these phases and reopen in a safe way. So I think that we are very well positioned to be successful. We just need to work together as a state, continue to do the things we need to do. Again, wearing face covering, washing your hands, and waiting 6 feet apart. Those are going to be the key that allow us to move through these phases and not see a spike in our numbers in any place in the state. We want to approach this from a state perspective. I think we're stronger together that way, and I know we've set ourselves up for success. We just have to keep going and keep adhering to these guidance and helping to save lives.
That's good. I've heard a lot more optimism in the daily press briefings or weekly press briefings that we've been getting from you guys. So that's always good and encouraging to see those numbers. As far as capacity, you've mentioned testing and contact tracing and personal protective equipment and just what that looks like in our state. Is there any update on that? I know contact tracing has been a big push from your department and also just increasing the number of people we're able to test.
Yes, those are critical, right? Those are fundamental capabilities that we wanted to see get better before we started to ease the restrictions. And the great news is I think we're making huge progress on that. We still need to make more progress as we move through this, but we have doubled the number of daily tests that we've done over the last few weeks. We were averaging somewhere like 2,500 tests a day. We're now 5,000 or more per day, and that's good. We want to keep that up and see it even increase. We want to make sure that we're targeting testing to people who have symptoms of COVID-19, that's cough or fever. We want to also make sure that we are testing anyone who is in contact with someone who might have COVID-19. That's where the tracing comes in. So that component, the tracing is the detective work. When someone tests positive for COVID-19, we want to find out who they might have been in close contact with. That means within 6 feet for greater than 10 minutes or more, and we want those people who have been in contact with those people to go get a COVID-19 test as well. So the testing and the tracing are interlinked. We've done a lot of work to make sure our state is well positioned to do that as we start to ease these restrictions. So I feel pretty good. We have always more work to do, and we will keep continuing to do that work. We're still focused on getting the protective equipment that we need. Things have gotten a lot better on that front, but we still have work to do, particularly need gowns. Gowns are the thing that everyone's struggling to get, but feeling pretty good about where we are overall. So feeling very optimistic as we move into the rest of this week.
And I know that your department is looking at the percentage of positive tests right now, putting that into perspective. Why is that important to put not only testing, but the number of cases into perspective?
Right, so we know any one of those metrics we were looking at have limitations. So if we were just going to look at lab confirmed cases, first of all, we know that we're not capturing all the people who have COVID-19 in North Carolina. It's just the people who actually go get a test. So the reason we know that we're capturing more cases, we're doing more testing. When you double the amount of testing, you're going to find more cases, which is a good thing. We want to do that. But we don't want to hold our state back just because we're testing more, because that's what we want to be doing. So when you look at the percentage of positive in a relation to the total, it shows us that even as we're doing more testing, the percentage positives going down, and that tells me we're doing really well in North Carolina. We're very stable here, and that allows us to move forward to think about easing restrictions and then hopefully moving through phases of easing those restrictions. So overall, we're going in the positive direction, and I think as we work together for this, we're going to continue on that trend. If we look at the numbers, if we adhere to the guidance, I know that we're going to be able to be successful, and the only way we do this, though, is doing it together. Right? Everyone has to do the things that slow the spread of the virus. Otherwise, we put lives in jeopardy, and we may put our state in jeopardy of having to move backwards. No one wants to do that. We want to move forward. We want to reignite the economy. We want folks to get back to work and school. So there is a way to do this, and we're putting together the guidance to allow us to do that. So I just encourage everyone to follow that guidance as much as possible, because it's what's going to help us stop the spread and save lives, as well as return to our lives at work and at play.
As far as testing goes, staying on that topic, I know earlier you mentioned that the Triangle really got a good grip on testing earlier than other parts of the state. Of course, Greensboro, we cover the Triad area. We weren't as quick as the Triangle to get that PPE, to get those tests. Can you give us a snapshot of what the Triad area looks like now?
Yes, so that is right. The Triangle area was able to get testing up and running more quickly, but what we have worked on over the last number of weeks is how do we make sure we're sharing resources across our whole state, and so we've definitely seen an improvement. As we think about moving forward, particularly as I think about the Triad, is making sure that we're getting to every community. Again, we want folks with symptoms of COVID-19 to be getting testing. That's fever and cough. So if you have fever and cough, call your doctor or go to your local community health center. Seek out testing. We want to make sure that testing is available in all communities. And so that's the work that's going on. I think we're in much better position in the Triad than we were. I know Wake Forest Baptist, Cone Health have been anchor hospitals in the Triad area, Novant as well. So I know all of them are working to make sure that we are responding appropriately to COVID-19. But I think that we are still working to make sure we have community-based sites. We're working with organizations like Walmart or Walgreens and others to make sure that there are testing sites available in lots of communities across North Carolina.
A big question that we always get here at the station is how many people have recovered. I know that other states are looking at that. Some of our North Carolina counties are keeping a tally of that. Is it possible to say how many North Carolinians have recovered, and are you looking at that number at all?
Yes, so we know people have recovered. I've had family members personally who have had COVID-19 and have recovered. So the good news is the vast majority of folks are recovering. The question was in the math. How do we actually define that? Because people experience COVID-19 for different periods of time. So stay tuned. We've been working with the CDC, and I hope this week we'll be able to put out our first recovery number. So stay tuned for that. We just wanted to make sure we were in line with how everyone else was defining recovery. And so I think we're getting close. Our teams have been working closely with our partners at the Centers for Disease Control and hope to have that number out for folks this week. And then we can break that recovery number down by county, and folks can do their own math. Because, look, we know folks are recovering from this, which is good news. The issue going forward is we just want to make sure we're slowing the spread so that folks who are particularly at high risk of a bad outcome if they get COVID-19, those are the folks we really need to be protecting as we go forward.
Right. I like that. Stay tuned, Dr. Cohen. In television, we call that a tease. So you have to wait and stick around to see what's coming up next.
Right.
So just keep that in mind. You might have a future in television. I'm curious to know when you started to monitor COVID-19. You saw this happening in China. When did you think, if this comes to America, if this comes to North Carolina, this is how we need to handle a state response?
Yes, I've been asked that in a few interviews lately. Look, we were starting to prepare for things back when we first heard of it, early January timeframe. I think personally, the time for me when I said this is not like any kind of response I have seen before is when I saw a video that showed how the government in China stood up a hospital from the ground up in 10 days. I was like, that made me sit up and take notice in a very, very different way. If they needed to stand up an entire hospital in a city in 10 days, they were seeing something that we needed to pay attention to. We were already tracking and paying attention, but I think for me, it was the thing that signaled we need to think about an aggressive way to protect folks here in North Carolina so that we don't have to stand up a hospital in 10 days in order to have enough resources to care for the people of North Carolina. I want to slow the spread of this so that we have enough medical resources for people to use if they need it, and that's exactly what we've done. So we've already been successful at slowing the spread of the virus. The issue now is we need to continue it. We need to continue to slow that spread as we ease restrictions, and that's why it's so important for folks to be following the guidance as we go. We're going to be successful if we do that.
Not time to take our foot off the gas just yet, it sounds like.
That's right. That's right.
So obviously, Dr. Cohen, I have looked into your background, internal medicine, an impressive education resume, and work life. How does someone in your position, can someone in your position prepare for what we're calling an unprecedented pandemic?
Well, I think you can't, right? Because this is something no one has ever experienced before. But I feel lucky that I've had a number of leadership roles at times of crisis, both at the federal level and now a leadership role here at the state. Obviously, I'm a physician by training, so that's helpful in understanding both the science as well as understanding what my colleagues are going through on the front lines and how they're needing to work on surge plans and how we think about therapeutics and diagnostic tests. So I think all of that has been helpful. I've led in times of crisis. And look, though, I have a great team here, and we're not doing this alone. I get to talk to a lot of senior people from around the country who are really have been helpful to me personally as I think things through, and then a great team here to sort of put the plans in place that we need to protect North Carolina. So it's been a huge team effort, and again, a hard effort, but I think we're trying to do the best we can to make some hard decisions as we go, and thinking about the health of North Carolinians first and foremost.
Dr. Cohen, if I may, one final question, because I know you're busy and you have to run. We see you on our televisions. Everyone is starting to know your name here in North Carolina, but you have a personal life too. You have a family, you have kids. How has this been like for your family?
Yes, so I'm a mom and a wife. We have two daughters, ages 5 and 8, a kindergartner and second grader. They're Wake County school kids, so they're home, doing distance learning like the rest of the state. I'm lucky to have the best husband in the world, and we are lucky that our kids are doing great. They're learning a lot about the coronavirus in a very different way because of mom's job, but they're wonderful and also allow me to put in perspective all of this, right? Because we're doing it for the folks that we love, for our family, for our neighbors, for our communities. So we're faring well, though our lives are upside down like everyone else's. And so I know how hard this is for folks. It's been a real challenge, but I know that I see the light at the end of this tunnel. We're going to start to ease these restrictions, but it's going to take our collective action together that's going to keep us moving forward and allow us to keep this virus spread low and allow us to start to move through the world. So remember your 3 W's. Wait 6 feet apart, wear a face covering when you're going to be with people, and wash your hands, the 3 W's. So remember that, and we'll be moving forward and making progress in North Carolina.
I like that. All right. Well, thank you so much, Dr. Cohen. It was a pleasure to meet you virtually, and we'll see you again later on this evening. But I thank you for your transparency. We really appreciate all your department's doing.
Thank you. Thanks for having me.
All right,
Stay well.
Have a good one.